Well, we have a huge impact on our students. Our nursing program, for example, is oversubscribed, and we need more room and better facilities. And one of the things that we're doing now is raising money for sim labs and to help furnish the health center that's going along with the hospital. We have a trading area. I know when I was on the chamber, I think it was 250,000, but I think it's around 300,000. And to have this hospital here and the training facility in Grande Prairie is huge for not only our students, but the patients. And I know the cancer clinic is going to be a part of the hospital, and we all know how expensive it is to have to go to Edmonton, and families have to stay in hotels and so on. So to have that in Grande Prairie is a huge benefit. Well, just the facility, the rooms, I know there's some joint sort of classroom spaces as well, but there's classroom settings that are, basically mimic the hospital room. And of course, with technology these days, the simulation labs and the dolls from adults to infants, it's incredible. So, of course, to be accredited facility to teach nursing and other medical professions, you have to have that state-of-the-art equipment, and so that's going to be a huge bonus. Well, I think if you look at it globally, residents across the province should have accessibility to the state-of-the-art equipment. I'd mentioned earlier about an MRI, which the old hospital didn't have one, and we actually raised money for it. So you have to have, I think, the modern equipment. Not only for saving of lives, but also for recruiting of doctors and other professionals. I've always said back in the day when I was working for the hospital is, why would a doctor come up here if it doesn't have the equipment available to them? Because they can probably go anywhere. For myself, I think to see the facility like having a hospital and a college in the same building, I think creates huge synergies and potential of interaction between faculty and students and doctors and nurses, and to be this close to the college too, just the whole life experience of, we're very close to the theater and recreational facilities. I think it can create a great community on the sort of west side of town, even though we're more in the middle of town now. So I just think it has a huge potential for quality of life. And I've always said we should think of a hospital as a place of wellness, not of sickness. And I think that helps with just the attitude of everyone. Healthcare providers, and to have, I think, students in a facility that get hands-on experience, it's the best form of teaching. Yeah, I've always felt a hospital should be a place of wellness, not of sickness, and the same with mental health. I always say we always say, well, a mental illness. I would rather say mental wellness. I think we should be careful of how we state things, and we need to talk about it more. And I think the quality of life, just having an education facility and a hospital together creates some great synergies. And I think, especially in long-term care facilities as well, and what I like about the hospital being where it's located on the college campus, it also has land around it that I know we have lots of people that are interested in developing there, and that will happen as time comes. And I think there's lots of studies on getting younger people working with elderly people. That part of some of my research in, say, palliative care, for example, is there's a lot of loneliness. People at the last part of their life, maybe no one's coming to visit them, and that's probably the worst thing for them. So I think if we can create more facilities where there's more people interacting, whether it's through the arts. I know in some cities there's a fine arts program works with seniors, and so I just think there's so much potential, and to have these two facilities combined and the college right across the street, it will create a great environment for wellness.